Hello, welcome to my channel, Her Fertility Place. So in today's video, I'll be talking about fertility treatment options that we have for female infertility. Okay, so for female infertility, there are three basic ones that are being used, and the ones that are being chosen for you will depend on the cause or the reason for your infertility, right? So if you are having struggles or if you are having difficulty conceiving, or you are wondering which of the option to choose or which of the option to discuss with your gynecologist about, then you need to watch this video to the end. So but before I go into today's story, I would like to remind you to subscribe to this channel if you have not, and put on the notification bell so that you can always see my new videos. So stick with me as I go into today's story. Welcome back. So like I said, I will be talking about the different fertility treatment options that are being used nowadays, and basically they are divided into three of them, and I will be going into them right away. The first one is the oral medicine. So gynecologists use this oral medicine to help to induce ovulation in these women that are struggling to conceive, especially those ones that are finding it difficult to ovulate regularly. So some of them are letrozole, clomid, metformin. Okay, this clomid and letrozole actually do the same thing by helping to induce ovulation, while metformin actually helps help to prevent insulin resistance in women that are having insulin resistance. So it make them to be insulin sensitive so that it will stop affecting their eggs. And they also use other oral medicine for inducing ovulation. So the second one is surgical procedure. So this procedure or this surgery are done to help to remove the abnormalities in the female reproductive organs, such as endometriosis, fibroid, tuber blockages, and so on and so forth. So if there are like some kind of scars or damages in the female reproductive system, they actually prescribe these surgical procedures to help to remove those things that are injuring the woman from conceiving, especially in her organs, in her uterus, in her fallopian tube, and the rest of them, even in her ovary too. So the third one is assistant conception. This one is the one that they use the sperm, they find a way to make the sperm and the egg to come together, and then they are being implanted into the woman's womb or uterus. So this one involve maybe male donor, sperm donor, or egg donor, especially if the woman does not have good quality egg for her to conceive herself. So they request for donor, or if the man does not have good quality sperm to fertilize the egg, so they request for donor. So for example, IVF, and so on and so forth. So these are the three basic fertility treatment options that are being used for women that are finding it difficult to conceive by themselves. Okay, so now your gynecologist can recommend one or two of these treatment for you. Okay, so you may be having ovulation disorder and then having issues with your fallopian tube, then they will request that you do a surgery to help to remove those scars or blockages or damages in your fallopian tube. And then if you are also having difficulty ovulating too, you are being recommended those oral medicine to help to induce your ovulation so that everything will work together. But now if fertility if the oral drug cannot work, and then your sometimes they can request the three for you, because there may be complications, so you may be required. And that is why if although IVF actually rule out every other ones, because the egg and the sperm is being cultured in a place before it is being implanted in your womb. Okay, so your womb must also be clear without any fibroid or myoma to help in the implantation of the embryo that is being planted in your uterus. So these are the things that your gynecologist are going to look into and help you to decide and give you the right option for your specific or unique condition, right? So now we must not also rule out lifestyle changes. In fact, some women, it is even just lifestyle changes that they need and everything will be fine. Everything is going to fall into place. An example of these lifestyle changes is for the woman to get the right BMI. Okay, she must have the right body weight for conception. She must not be underweight and she must not be overweight. So they will recommend that she go into diet or make sure that she do some exercise to help her get into the appropriate fertility friendly weight that will help her to conceive with no issue, right? So another lifestyle changes that are being recommended is to avoid or stop smoking and taking alcohol, right? So if she's the type that smoke or take alcohol, she may be advised to stop taking those things, right? So now then stress management too. Stress management is also another lifestyle modification that are being recommended for women to increase their chances of conceiving. So if they realize that you are too stressed physically, mentally, emotionally, you are being advised to look for coping mechanism to help to reduce your stress. Then you are also being advised to take good quality sleep, right? So these are the things, lifestyle modification, that are being recommended for you also, alongside the three basic ones that I mentioned earlier. So this one too is also like a complement to those, to help them work together for you to get a better result on your fertility treatment options. I hope this has really helped you, so that by the time you go to your gynecologist, you will be aware, you have knowledge, and will be able to share your concern and then what you know with your gynecologist, right? So if you have not subscribed to this channel, please do so right now and watch out for my next